Well, I'm Dr. Schneider, and I'd love to talk to you a little bit more about facelift and neck lift. I've done over 7,000 procedures and several hundred facelift and neck lifts, and we're located right here in the Minneapolis Twin City area. Most of the time, our incision is going to be up in the hairline above the ear so that we can lift that mid-face a little bit. That avoids an incision in front of the hair that might be a little bit harder to conceal over time. Then we're going to be going down the face, working on the jawline, the jowl a little bit, as people like to call it, the marionette line, several different names. But basically, we all age from the top of our head to the tip of our toe. It's one complete sheet of skin, collagen, and elastin that's aging. And so as you're thinking about doing a facelift, you might be seeing changes in the under eye. You might be seeing a deepened nasolabial fold here, or maybe a marionette line. Or let's say the jowl is dropping down below the jawline. Or you've got a lot of loose skin in the neck, or maybe there's some fat there that needs to be liposuctioned. We do that all together here at Riverview Face and Body Aesthetics, and it's a unique patient-centered journey for a facelift. Most of our facelifts, we start at 9 a.m. and we typically last 5 to 6 hours. When we're making that incision, we want to do that very delicately, and we want to make sure that you're comfortable. So that's going to allow you to get that great rejuvenation of the mid-face, jowl, and neck that most people are concerned about. Now, sometimes this happens in their early 40s. Others come in their 50s or 60s, or maybe they come to the game late and they want to just have a little bit of a tuck and they're in their 70s. But all patients are good candidates for this as long as they're not smokers or really brittle diabetics. Some of our patients will be worried about looking too young. They'll say, well, I'm 60 years old. If I have a facelift or neck lift, am I going to look like I'm 40 years old and not fitting with my friends or colleagues? It's going to look about 5 to 7 years younger. It's going to look natural too. We're not here to make people look weird, but we just want to rejuvenate the area that they're concerned by. So that area is going to look and feel likely to be tighter. Ballpark, people will call and ask for pricing. I would say it's probably in the range of $14,000 to $18,000 for a facelift and neck lift, which includes liposuction as well. But again, you may not need that. Maybe you're thinking you need to have a facelift because your lower eyelids are looking puffy or there's loose skin there. Maybe a better consideration would be having lower eyelid surgery. Maybe you just need a little filler in your cheeks to add a little volume, where you're feeling like you've lost some volumes in the cheek, and rather than having a whole facelift, maybe you just need a syringe or two of filler. After you've had your facelift, there's going to be some post-operative care that we're going to want to review with you even prior to surgery, but definitely after surgery, you're going to be wearing a compression garment. So this is going to be a garment that keeps it nice and tight to help with swelling, minimizing bruising. That's going to go under your chin and generally around your neck. Sometimes we just have it around the chin like that. And that's going to be something that you're going to want to wear certainly almost continuously the first week. And then for the first month, when you're at home in the privacy of your home, you'll have your compression garment on as much as possible. To combat that kind of bruising and swelling, the garment is critical. In addition, we want people to be really as healthy as they can be. So avoiding smoking, making sure that you're getting good nutrition, you're eating plenty of protein, sitting upright in a chair as opposed to lying flat right away after surgery. We just don't want to have too much swelling. A lot of people are worried about having a lot of pain after surgery. This surgery generally doesn't have a lot of pain with it. People typically get pain medication like Percocet or Norco for a couple of days, but most of them transition very easily to like ibuprofen or Tylenol by postoperative day number 3. Most of our patients can get back to work depending on the degree of swelling and bruising that they're comfortable with. Makeup can be used in areas as long as it's not directly over the incision. At your 1-week follow-up appointment, if you have a lot of bruising, we're going to be able to use things like a laser to decrease some of that bruising right in the office. Most of that bruising and swelling is going to just be for that first couple of weeks. And so anything that you can do to minimize that is going to be to your advantage. I would encourage at least people to come in for a consultation so that you can get a better sense as to what your goals are and what can be accomplished easily with surgery.